A 50-year-old woman comes to the office concerned that her menstrual periods have stopped. She has also been experiencing some vaginal dryness and hot flashes. Which of the following hormones is most likely elevated in this patient? Now, this patient is having symptoms of menopause, and menopause is going to be defined as the permanent cessation of menses for 12 months. And because we're going to have low estrogen levels with menopause, symptoms like vaginal dryness and hot flashes can occur. Now, what is the hormone that is going to be most likely elevated in a menopause patient? Now, over time, women are going to be losing the follicles that they have, and the waiting follicles are going to contain granulosa cells, which are going to produce estrogen as well as inhibin B. Now, normally the hypothalamus is going to secrete GnRH, which then stimulates the anterior pituitary to produce FSH and LH. Now, these hormones are then going to act on the granulosa cells to produce estrogen as well as inhibin B. Now, estrogen is going to have a negative feedback on the hypothalamus as well as the anterior pituitary when it is produced. Now, with menopause, because we're losing these cells over time, we're going to have lower levels of estrogen and lower levels of inhibin B. And because of this, we're going to lose the negative feedback that these hormones have. So, with estrogen, we're going to have a loss of negative feedback to the hypothalamus and the anterior pituitary. So, as a result, we're going to have higher levels of GnRH, LH, as well as FSH in menopause patients. Now, because the granulosa cells also produce inhibin B, we're also going to lose the negative feedback coming from inhibin B. And inhibin B is only going to have a negative feedback on FSH. So as a result, the FSH levels are going to be elevated even more than these other hormones. So we can use this as a marker to diagnose menopause along with the cessation of menses.